Yeah, and in the beginning, I would like to take a group photo together. So please turn on your cameras and smile. Okay, so I will take the first photo. Three, two, one. 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 And the second one, three, two, one. Okay, perfect. So, Dino, the stage is yours and you can start your presentation.
Okay, thank you so much, Natalia, and welcome everyone. So my name is Dino, as Natalia mentioned, and I am the program coordinator for mental health under the IFMSA. It brings me a lot of pleasure to be able to be here with you guys and to talk about these important topics. So just give me 1 second until I share my screen because I'm not really good at technology or visual design as you are about to witness. So, do you see my presentation?
Yes, we can see.
Okay, thank you guys. So, I will talk about men's health and men's mental health statistics in particular. This is really important, and Movember is a great movement to shed some light on these important topics. So as we go through these numbers, I want you all to focus and to think about what does this tell us and what can we do about it. So let's just get right into it. So something about prevalence of mental health issues among men. Just let me remove this Zoom. Okay, so I can see. So as WHO says, approximately 17.3% of men worldwide experience a mental health disorder in a given year. So we are not talking only about mental distress, mental challenges. We are talking about mental health disorders. So almost 20% of men worldwide. And some of the common mental health disorders among men are, of course, major depressive disorder, anxiety disorders, and substance abuse. Substance abuse is really important to highlight because men oftentimes hide their emotions in different substances, and we will touch on this topic later on. But let's just introduce ourselves with some brief statistics and remember the numbers, okay? So the point of Movember is also raising awareness about high suicide rates among men. So men account for about 75% of all suicides. And the global rate for men when it comes to suicide is 13.5 per 100,000 population. This is extremely disastrous statistic. And when we know that suicide is the second most leading cause of death among individuals of our age, so between 15 and 29, this is something that should let us all really think about this, okay? So what about age disparities? We know that mental health issues affect everyone. They don't choose gender, they don't choose age group, but when it comes to men, it also varies. So young adults, again, our group, it says in the SAM HSA that men between 18 and 25 years old experience mental health issues such high rate as 25.8%. And when it comes to older men, so aged 50 and above, so our fathers, our grandfathers, maybe even brothers, they suffer from feelings related to isolation and aging. This is something that oftentimes isn't also really talked about because it is like common knowledge. When men get older, they should be tougher, they should be, stronger, but the isolation and aging really also, hits men too. We oftentimes talk about, it's not really good to talk about aging when it comes to women, etc., which is all very true, but it also affects men very much. So you will hear something about socioeconomic background from Mayur later on, but I just wanted to put this here because the prevalence of individuals with lower socioeconomic status, they are more likely to experience mental health issues, as WHO states. And what is really important is that when they do encounter mental health issues, when men from lower socioeconomic backgrounds suffer from some mental health disorders, they don't have the same access to the care they are needed as someone from middle or higher class countries. So we should also have this in mind when we are talking about these communities, because this is also a significant factor that, of course, impacts their ability to get better. What about the workplace impact? We know that work-related stress affects a substantial number of men. And according to my next source, the American Institute of Stress, work-related stress is responsible for a lot of deaths per year. More than 100,000 deaths is associated with various mental health issues that stem from workplace. And not only that this is a great cost in human lives, it is also, of course, a great cost for the global economy. It is approximated that about $1 trillion dollars per year are lost in productivity because of the deaths from people who are suffering from work-related stress. So what have we been talking about so far? We have talked about the socioeconomic background, the workplace also. So we should not really forget the greater picture because we, all of us have a, let's say, sort of imaginary person who is suffering from mental health disorders. All of us think of this person in some way. And oftentimes that person is really ordinary from the outside. And when talking about men, it's even more so that they don't really show it. They will suffer in the workplace. They will suffer, sorry, in their communities. And not a lot of people will actually realize because we don't really give much space to these specific situations, unfortunately. And we as men also don't really help because, as it says here, approximately 60% of men do not seek help for mental health issues. Why is that so? It's of course because of the stigma. It's because of the perception that when men ask for help, they are weak. They are not delivering their role in the society. They are disappointing. These are some major barriers that are preventing men from seeking support every day. And we should really work towards um, normalizing, or not even normalizing, but, advocating for men to be able or to have space for seeking help. So something more about stigma. 62% of men. So as I wrote here on this slide, there was a survey that was conducted by the National Institute of Mental Health in 2021, so not long time ago. And this survey showed that 62% of men cited stigma as a significant barrier to seeking mental health support. So men are very much aware of the stigma. Men are very much aware um, of the weight this has on them, because they are supposed or expected to act certain way. So there was another source that said that approximately 78% of men engage in healthy coping mechanisms, such as exercise, socializing, or seeking professional help. But it was really funny to me because I don't really think this is true. I don't know about you guys, but I feel like if we ask men, how do you cope? They will say, oh, yeah, I exercise, I socialize, I ask for help. But do they really? I don't think so, because if men were really having 80% of healthy coping mechanisms, none of us would be here today talking about this topic. So this only proves to me, and I hope to all of you as well, that men are also ashamed to admit that some things may not be as they seem, because we know that the major coping mechanism and its coping mechanism is substance abuse. So I wanted to touch about regional disparities, because most of the sources that I found have been the statistics from the United States of America, but I am not American, and I think that most of you also are not. So in Europe, it is estimated that approximately 15% of men experience mental health challenges annually. So something that one teacher of mine told me whenever reading about statistics about men, always at least double it, because men often don't really say the truth. We tend to lie when it comes to these sensitive topics. So I would say that it's at least 30% that experience mental health challenges. And I want to ask all of you, boys and men out here, just think to yourself, do you experience mental health challenges annually? I think all of you would say yes, for sure. And yes, there is also intersectionality, because 45% of men from marginalized communities, they face high rates of mental health challenges. It is not that this is shocking. It's of course that people or men from marginalized communities do experience higher rates of all of the challenges, mental health challenges, physical health challenges. But it's that this is oftentimes overseen. So we don't really think about the marginalized communities. So please, when you start working in your fields, wherever you end up, wherever I end up, let's not forget about the marginalized communities. Let's not forget about the specific set of challenges that these people face that are oftentimes overseen. And something about positive trends and initiatives was encouraging, and this workshop today is also an example, is that there is a growing recognition of men's mental health. So there is about 30% of organizations that are implementing mental health programs specifically tailored for men. This is really, really nice. And what I want to ask all of you guys is, where are these organizations? Is your organization one of those that is shedding light on this topic? And what can we do as students? How can we advocate? Does it only have to be through Movember? Should we do something regularly? Should we really think about this? I think yes. And just to finish up my part, men need safe spaces to express their emotions and seek help without judgment. And all of us should work towards fostering an environment of empathy, of understanding, of acceptance. We should really encourage all men around us to prioritize their mental health and seek help when needed, not only when it's too late, and really to seek help and not to bury it under substance abuse, under overworking. You all know your fathers, your grandfathers, who maybe have been doing this because it is cultural. I will even say, when men suffer, they will just work. They will work more. They will have to provide more. But is this really the answer? We should all promote the idea that seeking help is really a sign of strength and not weakness. So to conclude this part, I hope this kind of opened your eyes a little bit more, because I believe that all of you are already very, advanced, because you participate in these sessions, you are thinking about these topics. But when we are addressing men's mental health and health in general, because we have been talking about prostate cancer, testicular cancer, as Natalia mentioned, that Movember is all about, this is a multi-faced challenge. This is something that should be approached from all of the different aspects, angles, and we should really work by understanding the statistics. We should break the stigma and foster open communications, because all of us together as future professionals, it's us who can collectively work towards a healthier future. And thank you for your attention. Thank you for bearing with this really minimalistic graphic design of my presentation. I'm really not talented for PowerPoints, but I hope that you learned something. And I always like to say that I think that our generation is the one who will be the change. I don't know if every generation says that, but to kind of, tell them to themselves, but I really believe this. I believe in all of us, and I think that we will do great things regarding men's mental health and all of the other things that we are working on. So thank you so much for your attention, and this is it for my part.
Thank you, Dino, for the great presentation and your words. The presentation was very interesting, and if anyone has a question for Dino, you can ask him during the discussion after. Now I would like to give the stage to our second speaker from IPSF, Mayor Taylor.
Hi, can you guys hear me all okay?
Yes.
Yeah, okay, perfect. Yeah, thank you so much, first of all, for having me give this talk today. It's obviously a very important topic, and we're glad, very honored to have the opportunity to kind of speak about this. So yeah, welcome everyone. Today we're going to be delving into some of the critical topics of men's mental health, and particularly talking about some of the socioeconomic challenges that can be faced. So as we kind of go through the presentation, we'll explore common health problems affecting men and various factors influencing their health expectancy. So just to kind of go over things in a nutshell, what I'm going to be going over, just a few common diseases. I'm sure we're all very familiar with cardiovascular and prostate diseases, but these are two of the main ones that do affect men. And these are things that can then lead to challenges in socioeconomics. Followed by this, we're diving a little bit deeper into the economic disparities. So what are the barriers to healthcare and their services? Going into stress and mental health. So really, what are the socioeconomic factors and the stress that's faced? And then lastly, what can we actually do about all of this? So what can we do from a health promotion perspective? So public health campaigns, educational programs. These are all things that healthcare providers, whether they be in medicine or pharmacy, can often take part in or even lead to help those in need. So before we kind of just jump right into things, I know we went through a lot of statistics, and thank you so much for that great presentation, Dino. But I do often like to see how much do we actually remember and how much do we already know. So before you guys ask me questions, I'm actually asking you questions. So just to start off, you guys can just put the answers into the chat. Some of the ones actually Dino I think already talked about, so maybe you can guess some of them. But it's not a pop quiz or anything. It's just to kind of see how much you'll remember or already know, and then you kind of know how much do you have to what things you have to be focusing on throughout the presentation. So for question number one, what is the average life expectancy for a man globally? 68%, age 68, 73, 79, or 83? You can just put the answer simply in the chat. 83, A, 73. Okay, so we got a couple good guesses. Seems like quite across the board, but glad everyone's participating. So the answer is actually 79, and the male expectancy is 79, while for women it actually is just under 83. And this is from the Office of National Statistics from 2021. So maybe the numbers have changed. I couldn't find anything more recent that was a global statistic. But yeah, just to give you a perspective, 79 is the average life expectancy for a male, while about 83 is that of for a woman. The next question is, what percent of men are achieving the government recommended level of physical activity? Now, I know this might vary from country to country and even, from province to province, so especially in Canada as well. But on average, we say it's about 30 minutes to an hour per day. So if you were to take a guess, how much percent would you say? These some options here. 28, 40. 40 is not one of the options. B. Okay. Actually, you'd be probably surprised to know it's actually 6%, and this is from the NHS from 2014. So maybe numbers have changed a little bit, but it is quite low, under 10% still. So, that is of concern, especially as we kind of start to see more of the prevalence of some of these diseases rise. And then last question I have for you is what percent of men will put going off to the doctor even when showing signs of illness? So 25%, 50%, 75%, or 90%? 70%, 25%. Yeah, so this actually is 75%. So 75% of men put out going off to the doctor, they're showing signs of illness, and roughly 38% of men actually say that it's completely not important. So again, it is quite high, and recognizing the fact that there's something kind of at large at play that's putting them from going to see and seek the medical help that they do need in order to get better and maintain a healthy life. So now we'll kind of dump a little bit deeper into, what are the common health conditions? I know you've probably talked a lot about these in classes or even throughout the Movember campaign. So I'm not going to go over things clinically, but rather they're just things to keep in mind while going through the presentation itself. So in no way is this a clinical talk, but rather one just to give you an overall understanding and a refresher about some of the diseases that you might come across when dealing with men's health. So the first one is cardiovascular diseases. And so this is a leading cause of mortality amongst men. High blood pressure, heart attack, stroke are all very prevalent amongst men. And it's crucial to adopt a healthy heart lifestyle, as we say, including regular exercise, balanced diet. And so these are all important things to be counseling patients on, keeping in mind. If you see a patient coming in for cardiovascular disease, maybe they're coming in for a new prescription in the pharmacy that you see they just got prescribed a statin medication. These are kind of the things that I like to keep in the back of my mind, that the questions that they might come up, or even kind of probe them as to see how much they already know and why they might be taking the medications that they've been prescribed, because that often helps that as well. Moving on to prostate health, there's a lot of risks associated with prostate cancer and BPH as well. So a very important part of both of those things is early detection through screening, which plays a very pivotal role in managing this different conditions. So encouraging men to get out there and get screening done. I personally, it's very difficult even amongst my family to say, hey, you should be getting your for prostate cancer is quite prevalent, especially in some of the North American culture. So, and I'm sure it is in other countries as well. So, making sure they feel okay getting these types of screenings done, and making sure this is not something to be scared of, but rather something that should be part of a routine medical checkup, which unfortunately at this point in time it does not seem like it is. So now jumping into some of the factors themselves which can lower men's health expectancy. So the first one here is lifestyle choices. I'm sure you've heard this numerous times before, but the impact of lifestyle choices on men's health is very crucial. We're talking about things like smoking, excessive alcohol consumption, as Dina went through some of the stats previously, and poor dietary habits are recognized as significant contributors to health issues. It's very imperative for men to cultivate this mindfulness about these different factors and acknowledge the potential risks. And this way that we can very proactively make a positive change that can foster this long-term well-being for many men. And this is kind of across the board. It's not just specific to men itself, but this is something that we're talking about in this discussion. So this can be extrapolated to other populations as well. The next one is genetic predisposition. And so understanding family history and genetic predisposition is very key. So this way you can know what your risk factors are, and this allows for more proactive health management. So, genetic screening is a new tool that's coming up that's now been actually introduced in some of the pharmacies in Canada now. So I'm sure it already is introduced in other countries or will soon be introduced. And so this kind of can tell you, say someone more likely to have prostate cancer and what can we do to kind of eliminate some of the other risk factors they might have for it. And so this way you can kind of prioritize the importance and urgency of different factors at play. And then the last one here is a lack of preventative health care. So, regular checkups and screenings are very fundamental for preventative health care. Staying vigilant with the routine medical visits is very important for early detection of potential health issues. And we'll see this as a reoccurring theme throughout the presentation, that early the early detection is key. So this way you can have a very proactive healthcare measure and enhance the likelihood of any sort of negative outcomes from occurring. So it kind of prohibits those negative outcomes, and this way can promote an overall well-being. So the socioeconomic factors that I really wanted to touch on in this sort of presentation, there's three of them. So the first one is economic disparities. And economic disparities directly affect men's health by limiting access to healthcare resources and the services. And the interconnectedness between access to healthcare and overall quality of life really underscores the critical role of addressing economic inequalities for better health outcomes. So, not having the financial ability or not having the able to even access the healthcare in general. Maybe it costs too much, depending on how these factors come into play. I know this is a very big topic, not as much in Canada, but it is something that comes up quite a bit in the US. Can they afford certain types of healthcare? Is there a cheaper option available? Does insurance cover it? These are all things that are going in the back of a healthcare provider's mind, unfortunately. It'd be great if everything could be free or public access to patients across the globe, but unfortunately, this is not the case. The next thing is education and employment effects. So education and employment significantly shape men's well-being, influencing health choices through knowledge and affecting stress levels based on job-related factors. And so the interplay of these factors really has a broad impact because education and employment, can really change the quality of life of someone. So if they don't have that social aspect of going to work, if they're not kind of talking to people who are going through maybe some other thing that they're going to, this way they can kind of build this sense of network and this sense of community that really can help them, tackle any struggle that they may be encountering. And also they can gain insights and new things that might be happening through education. And but they can also know, smoking maybe not is the best option, or, how much alcohol can they consume before it's considered to be dangerous. And so this way, getting that education and the higher the level of education, we're obviously very fortunate being in the healthcare space. A lot of this comes very second nature to us, but that's not the case for everyone. So being mindful of these things when you're actually talking to patients. The last one here is actually access to healthcare services. So there's many barriers to healthcare and disparities, and I know this is a little bit general, but they can vary quite a bit across the globe. And so just taking medical care. There is a lot of unequal health outcomes for many men globally, and so improving access to healthcare is very paramount to addressing these challenges and promoting better health overall. Unfortunately, there's not a one-size-fits-all for this. It is very different from country to country. I would even say city to city in some cases. So, really knowing what demographic you're working with, how is the access to healthcare where you currently live? What things can you do to make that more easily accessible? And so, for example, in Canada, something that we've implemented into our healthcare system is now that the pharmacist can actually have many prescribing rights. So whether, for the 30 different conditions, we can prescribe the medications right in the pharmacy. So we write the prescription, we fill it, we diagnose them, we do the whole assessment. So that's one way that, we've implemented this access to healthcare services right in the pharmacy, because there's a big shortage currently of physicians. So there's different ways about doing that, and that's just one way that does seem to have been successful here in Canada, at least. So now the intersection between the socioeconomic factors and mental health is obviously that's very important. I'm sure you've heard a little bit about this throughout the last month as well. But stress and mental health, the relationship between stress and mental health can profoundly shape men's mental health, because it impacts both the mental and the physical well-being. So addressing these dynamics as a pharmacist is imperative for fostering these long-term relationships and holistic approach to men's healthcare, and really recognizing the fact that they are interconnected and the nature of these social and psychological factors. So, if someone is going through a lot of stress and they have, a lot of stuff going on in that space, taking the time to really, understand, what it is that they are going through and what it is that you can provide as their doctor or as their pharmacist, and how can you make things a little bit easier for them, or at least ease their mind, especially when they're going through these therapies or making medication changes, is very important. And then talking about social support systems. So I touched on this a little bit earlier, but social support systems are integral for mental health well-being and providing a crucial foundation for this for emotions and stress reduction. Strong social connections contribute to positive mental health outcomes, and emphasizing the importance of fostering these supportive relationships is very important. So figuring out, who is their support system when they do need help with something. And this is something that I found in the more recent years, especially while I was working in different psychiatric settings. We try to loop in other family members, other support systems into the actual patient's treatment plan, having regular meetings with them as well to help them understand, what it is that their patient is going, what it is that their family member is going through, and how can we better support them as not just as a patient, but as a family as a whole. So this is something to be very cognizant of, especially when you're dealing with mental health. So now, how can we actually address these, mental health disparities as healthcare professionals? So, talking about strategies for health promotion, so public health campaigns, educational programs, pharmacists can play a very crucial role in health promotion and through these different campaigns, and they can offer valuable expertise in medication management, preventative care. They can be involved in the educational programs such as workshops like this one in particular. Or on healthy living and medication adherence. And this way you can actually empower the community as a whole with the knowledge that they need to be more proactive about their health choices, and really leverage the accessibility and knowledge that pharmacists or healthcare providers in general have to contribute to the overall community and health of the community. The second thing is here, and again, touching on this once again, the importance of early detection and intervention. And so encouraging these regular health checkups and screenings is very pivotal and for proactive health management. And these preventative measures enable early detection for potential health issues and therefore better health outcomes as well. So, whether that be in the pharmacy or by a physician, if you can find a way to screen for cancers or screen for any prostate issues or screen for any of these conditions that can be very easily done. There are cancer screening tools that look at family history that you can use online. So when someone is picking up medications or they're coming in for a new medication or whatever it might be, and you see that they have a couple different other risk factors for a certain condition, just taking the time to quickly screen them, say, hey, these are different factors that I think can lead to an increased risk of this condition. It might be worthwhile to talk to your physician next time you're in to see if we can do some testing done or do once a year testing, for example. So unfortunately, there is sometimes a cost associated with that, and I know there's a lot of push worldwide currently to kind of alleviate some of that cost, but unfortunately, that is something that's currently being worked on. And so, stay tuned. Hopefully, that does come around sooner rather than later. But it is something that I know countries all across the world are currently working on. So with that, in conclusion, I know we went through quite a bit today. So just to quickly recap, common health problems amongst men are cardiovascular diseases and prostate health issues. There are many factors affecting health expectancy, and these range from lifestyle choices to genetics, and therefore play a role in preventative healthcare. The socioeconomic impacts, so economic disparities, limited access, the role of employment and education in mental health, and then the intersection with that with mental health. Stress is a big factor amongst is a big factor amongst the socioeconomic factors, and therefore it is very crucial to have a social support system. And lastly, we went through some strategies of improvement and how can we kind of move forward to make things a little bit easier and at least take some steps in the right direction. So really emphasizing the significance of early detection and addressing some of those disparities. So with that, that's kind of the end of the presentation. And again, thank you so much for having me. Happy to answer any questions. And if you do ever want to contact me for, whether to talk about mental health or any other questions revolving pharmacy or Canada in general, always happy to answer them. And my email is there on the screen. Yeah.
Also, thank you, Mayor, for the interesting presentation and information. We have one question in audience, but yeah, we will give the space for this in Q&A part. And now we would move to discussion. So our first question for you is, where can men find psychological help, and if you have any resources?
Yeah, so again, this is something that does vary from country to country and from I would even say city to city. So you have to really take the time. I do have a couple of resources and I can email them to you, but again, those are the ones that are specific to the populations that I work with personally. So whether that's in a psychiatric setting here in Ottawa, and so just quickly taking the time to Google that, to be honest, psychiatric or men's mental health resources in whatever city or country you can. A lot of them will come up just by simply Googling that, but I can provide some here locally in my area, but these are things that are a little bit more localized rather than global, because the issues that that men are facing, especially when talking about some of these different factors at play, can vary from place to place. And so maybe they might be funded, for example, something might be funded in Canada but might not be funded in another country, or vice versa as well. So I can definitely send you some resources. I know that a lot of our hospitals here have resources available. There is kind of a counseling services that are available. So these are different things that you can look into, and sometimes just quickly Googling them at what's available currently in your area, I think, is the best way to go about it, just because it can vary again from place to place.
Yeah, perfect. And Dina, what do you think about this question? Where can men find psychological help? And if you have any resources, you can share them with us.
So as Mayur said, there is really not something that is universal. It is specific to the city or to the region, to the country. But what I would want to highlight is that we should not, how do I say it? We should not say where can men find or seek help, because it should be normal for everyone to seek help. That's what we should be working towards. So not like where can men seek help, but where can anyone who has some sort of issue, some sort of distress, seek help. And although it is for some local communities, some local organizations, psychologists, psychiatrists, therapists, there are really I don't think the biggest part of this is where can they find help, is how will they decide to seek help. So I think that we should really emphasize the how rather than where. So that's what I would say about.
Thank you so much for your insightful answer. The next question would be, what is the difference, or what should be a difference in psychological treatment of men and women?
Yeah, so I guess I can touch a little bit on this. There isn't necessarily a difference in psychological treatment between men and women, and given that there is kind of a lot of different dynamics, especially involving gender. So I don't necessarily say there's a big difference between how is the treatment actually given, but rather how do we decide which treatment is most beneficial for the patient specific. So generalizing it to one specific gender should receive this or that, I don't think necessarily the way to go about it, but rather looking at the holistic picture. Would this patient benefit from, for example, SSRI? Would the patient benefit more likely from counseling services? Or would they benefit from, maybe more social interaction? These are the kind of different, options that we have in front of us, and kind of, looking at the different options for the specific patient, looking to see what risk factors that they have, and then kind of coming up with what be the best treatment option for them, I think is a better way to go about it, rather than saying, men should get this or women should get that.
Yes, and we should also think about the differences of, how they present with certain disorders, because, um, men oftentimes present with aggression. They are heteroaggressive, autoaggressive. We know that a lot of the high suicide rate is among men. They dive into different substance abusing, etc. So we should really be thinking also about that difference. while women are shown to have more, classic emotional reactions to stress, crying, isolation, staying inside. Men don't usually show these prototypical, signs that they are struggling. So oftentimes we overlook it, we get past it, we don't really even acknowledge that they are suffering. So I would also add that as some differences or what to look out for when we are, dealing with men having issues. So, some key differences.
Yeah, thank you so much. The third question is, how do you see the role of a doctor and the role of a pharmacist in supporting men's health? So, Mayor, you can start.
Yeah, for sure. So I think that there's a lot of room for improvement in this area, just because there has been a lot of stigma in the past about men receiving help for mental disorders or mental health. So the way that for example, and I think Dino put this very correctly, looking at from a physician's perspective, I'm sure he can touch on this a lot more than I can, is how do the diagnostics differ? How do the symptoms differ from men to women? And how can we kind of, figure out, which condition they're kind of presenting with? I know, for example, from personal experience, it can be very difficult to sometimes determine bipolar disorder, whether it's bipolar 1 or bipolar 2 amongst men, because they're presenting, in a very hyper aggressive state. So that's just from my own experience. I know it can be quite difficult to diagnose them. And then from a pharmacist perspective, and again, I'll let Dino kind of touch on that a little bit more because I'm sure that's his area of expertise. From a pharmacy perspective, looking at things like treatment and how long would someone take to respond to a certain treatment, and as I'm sure many of you do know, SSRIs is oftentimes used for many mental health conditions, and given that men have a very high suicide rate who have mental health conditions, there is that 2 to 3 week window, sometimes even longer, where the suicide rate actually increases when starting SSRI. And so keeping these things in mind, is that necessarily going to be the best treatment option? Making sure that they're well aware of this, making sure you're following up with some of the patients during this time as pharmacists to make sure that they're okay. Are they presenting with any symptoms? And kind of taking the time to really ensure that you're following through after just giving them the medication and then, okay, go and we'll follow up with you in a month to see how things are going. But rather, okay, it's been a week since the patient left to pick up that medication. It was the first time they're taking it. I have a couple other risk factors. Maybe I should give them a phone call to see how things are going. So keeping these things in mind, what medication are they given? What are common side effects of this? And how does that affect the specific patient? I think are very important as pharmacists in order to kind of keep that continuity of care.
Dino,
Yes, exactly. And also, yes, thank you. I would also like to add that when prescribing a medication, when giving out medication, we should really try our best to explain some things to men because they are oftentimes scared. They don't really know. They don't really understand. We should really be thinking about the greater picture. For an example, men who are taking some, antidepressants or some more sensitive medications, if I can, say it like that. We should really, understand the worry. We should understand the fear that they are going through and really try to explain, try to be their allies, partners, because that's really important. And also doctors and pharmacists should, of course, collaborate. They should really be working together toward achieving these common goals, because a care for patients should be holistic. We should really be thinking about all the factors that are contributing to the disease. So mental and physical, of course, we should really address their well-being as future doctors. Let's say when they come to our doctor's office, we should ask them, how are you doing? What's been going on? Not just to get it over with really quickly as some doctors do. And also we should really be there for them to sort of help them understand.
Thank you. The next question is about socioeconomic background. Men's health can also be influenced by them belonging to other minority demographic groups, factors such as race, sexuality, disability, and so on. How can future healthcare professionals change these healthcare disparities going forwards?
Yeah, so I think I can quickly touch on this as well, and I think because I talked about a little bit about it in my presentation, and so again, as I spoke up to this about before, like, there is a lot of differences between different locations, whether it be different cities, different cultures, different ethnic backgrounds, and so there's a lot of different aspects of what's going on that can affect men's the socioeconomic statics and men's health, mental health overall. I think that the best way that as healthcare providers we can become more cognizant and to understand a little bit about what someone might be going through is through education itself. And so I know there's been a lot of push in education to kind of have some background understanding of what might, what things might be going on in our patients' lives. So, for example, there are certain cultural festivities that may, change the diet of a patient, and that could then lead to different health outcomes. And maybe they don't want to participate in their own culture because of these dietary changes. And so, for example, fasting is one thing that often comes up, and this is especially difficult for example, diabetic patients. But because of cultural fasting, they might not be eating a lot of food during the day, and then they're eating a ton of food at night, which obviously makes it very difficult for to treat diabetes. But being cognizant of, when you can ask patients, okay, when are you going to be fasting? Do you have a timetable? And then kind of coming up with a little bit of a plan as to how we're going to go about doing this. And maybe we need to change their insulin dosing because of this beforehand. So keeping all those different things in mind and keeping and kind of coming up with a plan before these things kind of occur can make this a lot easier and can often help the patient before the problem even arises. So I think, through education and through talking to the patient, what's going on in their lives, just beyond their health, but rather to look at them as a whole picture of what's going on in the next couple months, what things might change the prescription, or things might change their health in the upcoming future. That way you can kind of figure out the best course of action for them.
Also to be mindful of their differences, to have in mind what are specific challenges that some, minority is facing, like what is their reality and how does it differ from ours. Not to try to just make everything universal, because that's not the reality. Certain minorities are facing their own difficulties that should be addressed properly. So we should always have that in mind. Know who are we speaking with and what's something that's unique for their background, implement that in our treatment.
Thank you again. And other question is, what impact do you think the Movember campaign can have on men's health?
Yes, I guess I can touch on this one a little bit too. And I know, for example, things like this, doing workshops, doing seminars, and especially, it's very nice to see that this is happening on a global level, I think is very important. And, this way you can kind of see different, different cultures, see what's going on in different countries, see how they approaching these different issues that are occurring, and how can we bring some of those lessons into our own respective practices. And so, to creating that sense of awareness, especially on a global level, can really, I think, promote a sense of well-being, because you're almost creating a sense of community amongst itself, whether a global community. And this way you can, people who are going through these different issues, and they don't feel alone. I think one step further than that we can take it is kind of creating these sort of seminars for patients and themselves, to help them understand what they're going through is okay, and here are some steps that they can take. And so often as healthcare providers, we create these workshops and seminars for amongst ourselves to educate one another, but I think that taking it a step further and actually creating them for patients and those in the community would kind of be the next step that I could see the Movember campaign taking, and that way, we're really getting out in the community and explaining to them, these are the symptoms you should be looking out for. Here are things that you should be screening for, and that way, kind of, you're destigmatizing a lot of the things that have happened in the past.
Yes, and I would also just add something that I think of these campaigns as a starting point. I often realize that we do this, like we are so proactive during Movember or November, and then there's nothing. So I really want to emphasize this and kind of motivate all of us to really keep doing the work. Men's health is not something that is only reserved for November, as all of us know. It should really be worked on throughout the whole year. Although we all are really proactive during this month, all of you, this is a great initiative. So kudos to the organizers for this interactive workshop, but let's continue the work. Let's not stop here, and let's not end only with this workshop.
Thank you so much, and very good point. The last question, what actions can we take as healthcare students or professionals to support and improve men's health?
Yeah, so there's a variety of steps that you can take, and I think the first step is education, and this is kind of one of those steps. So, getting education on what are the different what are the different conditions that men are commonly facing, what are the more sensitive ones, how to then approach these conditions, I think is the next step. If a patient comes in, they say they're having symptoms, especially as put it, some of the more sensitive conditions. What can we do to help them? What can we do to kind of make them feel a little bit safe? What can we do to make sure that they feel comfortable speaking to you? And what can we kind of destigmatizing that whole process, providing these kind of private spaces. And then from there, understanding, okay, what are the treatment options available, and understanding that there's no universal answer for everyone, but rather, here are the different options available, and then looking at patient-specific factors and decide which option we want to go with, and letting the patient and themselves kind of be a part of that process, I think is very important. So that way they're kind of the ones who have the autonomy to make decisions as to, they want to do this and not that, or, what's important to them. Maybe they want to look for something a little bit more, not routine. So taking all these different considerations, and and this all starts, I think, with the education of these different these mental conditions, as well as the treatment options available for these different conditions.
And I also think that we should first, get interested in certain topic. And after we are interested, we should educate first ourselves about it, learn the problem, get acquainted with the situation, and then educate others. As Mayur said, education is really the key of raising awareness, of lighting a fire in people, provoking them in a certain way, and then they will advocate. Then they will continue on with the work on a certain topic. And men's health is not different than this. It's a topic that should be, really well considered, because it is important, and we should really work towards making more people interested.
Thank you so much again. And now we will move to Q&A part. And if someone has a question, you can write it in the chat or turn on the microphone and ask. I think there is a question in chat. So yeah, Anina, you can.
Yes, I collected the questions already asked in the chat. So the first one is, isn't it true that most men die with prostate cancer, not from it?
That actually is true, that most men will, get prostate cancer if they live long enough. That's what statistics showed. So it's not the question, will you get prostate cancer as a man? It's like the question is, when will you get it? Because it is inevitable. So that's kind of a fun fact, or not so fun, because no one wants cancer, but it is a prostate cancer fact. It's just how our prostate works with age. So thank you for this interesting question.
We have a follow-up question. What are some lifestyle preventive measures for prostate cancer? Are there any?
Mayur, will you take this one, or?
Sure. So yeah, again, as you mentioned, that there are, it is inevitable that, someone will eventually get prostate cancer. But, there are common things that you can kind of maybe do to postpone this or decrease chances of prostate cancer. And so, things looking at, for example, alcohol consumption, smoking. I know obesity is also a large one that's associated with prostate cancer. I believe there's recent studies that even said like increased soy intake, large amounts of soy intake can also lead to this. So these are all common things that are like, part of that you can be avoided through a very healthy, active lifestyle. And so I think, overall, when you're considering these things, having that healthy, active lifestyle, looking at like their diet, looking at, what are their social factors, what are they doing on the weekends, are they having like 10 beers a weekend? And that's probably a big problem. And that does then have a tendency to have an increased risk of cancer. And so smoking as well is another one, because of the carcinogenic activity. So, these are all different factors I think that have to be considered. And, there is a very exhaustive list, I'm sure, of different things that can lead to prostate cancer. But I think overall, if we're looking just as a general whole picture, because I think that in itself could be a full-on talk, just looking at those risk factors. But looking at the whole picture, I think a healthy, active lifestyle can often, decrease chances of prostate cancer.
Thank you so much for your answer. Yes, Philip.
Hi, so I have a question. First of all, can you hear me?
Yes.
Yep.
Okay, great, thanks. So we talk a lot about stigmatization, and the question I have is like, what part of stigmatization isn't really stigmatization, but discrimination? So for instance, when a person, man or a woman, feels like if they talk about their mental health issues, they might lose their job. That isn't really stigmatization. That's more like, that's already a realm of discrimination. And it's like, it's not a culturally inappropriate when it's like, when talking about it, it's actually a problem, when you can actually lose your job or something like else. So do you think that part of this stigmatization is actually a discrimination? That's my question.
Well, unfortunately, I do believe that that is the case in some communities, in some countries. I don't really think that this is as common, at least in more developed countries, for people to, lose their jobs if something like this happens. But it is present. We should really work towards straying away from it, because I also know a lot of stories about, men or women who, got depressed, couldn't get out of bed, and then they lost their jobs, they lost their livelihoods because of this, because this is considered as weak, this is considered as something that is your fault, and you should, be responsible for not being able to to do the work, or whatever the situation may be. So this is a very good point, Philip, and I thank you for your question, because it can serve as a reflection point for all of us to really think about the consequences of stigma and discrimination when it comes to different mental health disorders or issues. Especially when it comes to men who are, expected to be the providers, the workforce, the one who, bring food to the table, although all of this is, of course, untrue. But it is the reality of a lot of our, societies. So this is actually a very good point, and we should all be working towards, demystifying this, and working towards raising awareness, and accepting that people should be given space to work on their mental health.
Okay, thank you. I have another question really fast, because it's not really relatable, but we're both Croatian. So what do you think the situation is like in Croatia objectively?
Well, in Croatia, situation is not really good, as you know. The stigma is really real, and I don't really think that we are someone who can, be proud of the things that they are doing when it comes to raising awareness of mental health. But I really do believe that we are getting better at it. I don't know if you would agree, but I think there is a positive trend right now going on about, a lot of campaigns, a lot of, public awareness of mental health is becoming more popular, and I really like that this is happening. I hope that you can agree that we are getting somewhere, but there is still
Thank you.
Also, we have another question from the chat. Does BetterHelp service work worldwide? And are online services for mental health good, or should we encourage people to meet therapists in person?
Yeah, so I think for the online, I can maybe answer that aspect of it. So I do think there is a role for online mental health services, and I think this role is in particular to people who don't have access to mental health resources. And so when you're looking at people who are living in more rural areas, or maybe to have issues with mobility, these are the people who actually may have even more mental health issues because of the lack of socialization, and they're not able to kind of get out, they're not able to see others, so these people who are probably would really benefit from any sort of mental health or appointments or counseling services, and it might be very difficult to get someone to go and see them in person. So, having these online resources, I think there's definitely a role for them there, because you could have someone who's in an urban center meet with them quite regularly through a virtual consultation. Now, on the flip side, there is obviously, benefits of in-person congresses, in-person, appointments, in-person counseling, because you're able to have that face-to-face interaction. You're able to look at hand gestures. You're able to kind of see their body language, and so you're able to kind of gauge things a little bit better, I'd say, in person. But there is definitely a role for both, and I think deciding what's best for the patient is what's kind of what it comes down to. There often is a ton of online resources available for many people, and sometimes the online ones also can have a little bit of less of a cost associated with them. So that's also something to consider when looking and trying to pick the best thing for patients.
So again, thank you for your answers. And in this way, I would like to say thank you all for finding the time today and for being able to spend these moments together. And yeah, it was very interesting topic. Thank you to everyone who joined us through the Zoom platform. Thanks again to our speakers, Mayor Taylor and Dino Juic. And in this time, I will stop recording the workshop and will send a link to the feedback form in the chat. So we would appreciate if you could take a moment to fill it out. And feedback is very important for us. After this workshop, we will also receive certificates of participation, which will be sent to you via email. So give me a minute.